Hello everyone, hope you all are doing well today. Our today's topic is about role of government in health. As you all are aware that health is an important aspect of our life. If we are healthy, we can live our life to the fullest. We don't have to think twice when eating certain things or doing certain tasks. We have the potential, we have the energy, and we have the freedom to do a lot of things when we are physically, mentally, emotionally healthy, isn't it? So let us understand how our government is helping in keeping the public healthy and what are the measures or the schemes they have related to health. The learning objective for our lesson is understand what health means, role of government in ensuring health, difference between public and private healthcare. So, what is health? A state of physical and mental well being, not just absence of illness. It includes clean environment, nutrition, and access to medical care. So, when we talk about health, it is not just the physical health. Nowadays, all the aspects together contribute to a healthy being. For example, our physical fitness, our mental well-being, emotional well-being, and at times also our spiritual well-being. So all of these aspects come under the bigger umbrella that is health. And of course, when we have to be healthy, we need a clean environment. Our surroundings should be clean. We should have proper food and nutrition. And whenever we tend to fall sick or we require medical help, there should be someone to care for us, isn't it? Only then we can tell that we are healthy. So why is health important? Healthy citizens contribute to the country's development. So right now we are looking at the economy aspect, how health is contributing to a greater economy. So the very first point that we have is when people are healthy, they can work productively, helping the economic growth. So as you know, as the citizens work, they contribute to the economy. And if we are healthy, we will definitely go and work harder. Health reduces poverty. If people are healthy, they spend less money on medical treatment and can earn a living. As simple as that, isn't it? When we are falling sick or we have any kind of conditions, medical conditions, we tend to spend a lot of money on our medical bills or the things that we buy to treat ourselves, which isn't wrong. But then if we tend to take care of ourselves, I'm sure there wouldn't be any need to go and spend money for the health. And nowadays there are health insurance coming up and every other family is taking up those health insurance because in this century the lifestyle has changed completely. Now even the younger generations are getting certain kind of diseases, they have been transferred, and there are so many things going on where health has been neglected. Next, good health supports education. Children who are healthy can attend school regularly and learn better. Now, you might understand this point better, right? You are a student right now. You know that you have been coming regularly to school or you've been missing school due to certain reasons, certain illness. And when you fall sick, you know what you have to go through, isn't it? So if you are healthy, if all the aspects are healthy, physical, mental, emotional, when you feel that you are at your best, that is when you attend school regularly, isn't it? Preventing disease is better than curing it. A healthy environment and preventive care reduce the need for expensive treatments. So at times it happens that we have a slight fever or we feel we are having a cold or any kind of a mild problem that we are facing, we tend to ignore it, and then what happens, it becomes so big that we need to visit the clinic as soon as possible, isn't it? So try to prevent at the earlier stage so that it doesn't become so big that you have to spend a bomb amount of money to get yourself treated. It is a human right, and definitely it is. Everyone has the right to live a healthy life, and it is the government's duty to ensure access to healthcare. So it's a human right. Now, there are basic needs such as food, protection, shelter, isn't it? So health is not neglected. It is important aspect, and government has to ensure for good healthcare services. Now, public healthcare system. The public healthcare system in India is a chain of health centers and hospitals run by the government. Okay, run by the government. So when it comes to public healthcare, it's a government run organization. So funded by the government, services are mostly free or low cost. So you must have heard that when you go to a government hospital, there are certain kind of tests which might require some amount, but most of the things are free or low cost for the people. Available in both rural and urban areas. So both of the people can benefit from this kind of schemes. Focuses on prevention and treatment of diseases. Health workers, doctors and nurses are employed by the government. So the entire chain is of the government, and it is run by the government, and the expenses, the treatments are being taken care by the government. What is private healthcare system? As the name suggests, private. So this private healthcare system includes clinics, hospitals and diagnostic centers that are owned and run by individuals, okay, or companies, not the government. So when it comes to private, it is all about some individuals or a group of people having a company and running it up, and not the government. So these are mostly paid services. Better facilities and shorter waiting time is available here. More common in cities and used by richer people. So the people who can actually afford paying a big amount, they tend to use this private healthcare systems. So government's role in health. What does government actually do? So they build hospitals and healthcare centers. They provide vaccines and medicines. Now I think COVID can be the best example, isn't it? When government had provided numerous vaccines for the people. Ensure clean water and sanitation. So not just clean water, but sanitation is important as well, and regulate private hospitals. And one of our SDG goals is clean water and sanitation. So I think that is a must when it comes to health, isn't it? So let's take an example. Pulse polio program. It was started by Indian government in 1995. Free vaccination for all children. Youth success in eradicating polio. So you can also ask your parents about this, and I'm sure they will definitely tell you that you also got a dose of polio when you were young. So do definitely ask your parents. Health and equality. Now let us understand how health and equality go together, how they walk hand in hand. Health and equality means that everyone should get equal access to healthcare, no matter they are rich or poor status, caste, gender or place of living. So now health shouldn't be based on where the person is coming from, how the person looks, which religion or caste they belong to. It should be equal. And why it is important? Poor people often can't afford private hospitals. People in villages may not have nearby health centers. Women and children may not get proper care due to neglect or discrimination. So, for all these above listed reasons, healthcare and equality should go hand in hand. What are the challenges that come across in public health? Let us understand. Overcrowded hospitals. So most of the government hospitals you see are overcrowded. The reality of today's hospitals is that people are just lying there. So many people are waiting outside the hospital. They're waiting for their turn, and it's too much of crowd. Shortage of doctors. The patients are more, but the doctors are less. Unequal distribution in rural areas. Shortage of medicines, lack of awareness. So you might be knowing during COVID times, when there was shortage of medicines, people were running helter skelter. They were afraid that they might lose their lives or the lives of their loved ones. So you know how it is to have shortage of medicines. So these are the challenges that public health face. Okay, so we have come to the end of the lesson, and while summing up, I just want to let you know that health is a human right. No one here can tell you that no, you cannot, be healthy, you cannot take up the service, or can stop you from having a clean and fresh environment. It's your right. Government plays key role in ensuring health. So there are numerous kinds of schemes, there are medicines, there are vaccines that government has. Make sure that you make yourself aware about these things, not just for yourself but for your family members. Both public and private system exist. So depending on your situation, or depending on what you want to go forward with, you can go for public and private sector systems. Both are available, and equal access to health is necessary. So when we talk about health, equality should go hand in hand, as I mentioned earlier, because it's a human right. Now let's look at the assignment questions. First, why is health considered important for individuals? We have already read how health is vital for our overall well-being and functioning, isn't it? So you are going to tell me in your own words, why is health important for you, for the people around you, and the citizens of India, and how it contributes to the economy. Second, list two differences between public and private healthcare systems in India. So while listing the differences, you can talk about their services, their infrastructure, the quality of doctors, medicines, the money to be paid, if it's a low cost, free of cost, or expensive. You can mention all of these points. Third, mention any two challenges faced by the public healthcare system in India. So public healthcare system is a healthcare system run by the government. So what are the challenges they come across? You can list those challenges. And lastly, I would like you to tell me your experience at a healthcare center. It might be a public or a private. Do let me know how was your experience in regard to the waiting time, the quality of the doctors, their expertise, or even as simple as how you felt when you went there. Okay, what was your experience? You can just share it with me, which I would really love to listen. Okay, so thank you. Hope you all are aware by now how government plays role in our health, regarding our health. So stay informed and stay healthy. Bye.